Welcome, welcome, welcome to this exciting Small Cell Smashers Fireside Chat. I'm Dr. Misty Shields, and I have the honor and privilege of co-hosting today with Ann Fish-Steagall, a oncology nurse extraordinaire. And we have amazing guests today. I know, Ann, we have a couple announcements that are really exciting I'd like to make. I'll pass it to you.
Absolutely. Thank you, Dr. Shields. We are super excited to announce our first ever Smashers Live event. So the first weekend in May 1st through the 3rd, and you may have seen this on social media, you may have seen it already, is what we call our Hope Summit. And it's our big community gathering of all lung cancer patients. But this year, on Friday, we're going to have a special day just for our Smashers. So if you go to our your Facebook page for Smashers, there's going to be a link for registering there, but there's also registration on the LUNGevity homepage. So it will tell you more about Hope Summit in general, but we really hope to see all of you there for a really exciting day on Friday dedicated just to our Smashers community. Dr. Shields?
Thank you, Anne. We are really looking forward to this and so excited to bring the Smashers to a live event so we can all hug each other, encourage each other, and get together in one place. So we hope you can join us. Well, let's get started. So I have the privilege of introducing a very close friend of mine who I've actually known for goodness, right, 10 years. We were baby interns together at Vanderbilt University Medical Center, where we did our internal medicine residency, and both went to fellowships and now are both thoracic medical oncologists. So I have the privilege to introduce the lung onc doc, Dr. Eric Singhi, who is an assistant professor, a thoracic medical oncologist at University of Texas MD Anderson Medical Center. This is MD Anderson Cancer Center, probably the biggest cancer center in the United States. And Eric completed his internal medicine residency, as mentioned, at Vanderbilt. He was a chief heme-onc fellow at MD Anderson during his training. As faculty since 2022 at MD Anderson, Dr. Eric Singhi specializes in patient education research and young onset lung cancer research. He serves as the medical oncology lead for MD Anderson Young Onset Lung Cancer Program, patient safety quality officer, so important for the thoracic medical oncology service line, director of thoracic research for MD Anderson Cancer Network, and director of the thoracic medical oncology rotation for MD Anderson Medical Oncology Fellowship Program. And he serves on national guidelines for ASCO for the guidelines for non-small cell lung cancer and internationally for the ISLC Communications Committee. Again, we are so excited for you to be here. Welcome, Dr. Singhi.
Oh, thanks, Dr. Shields. Thanks, Anne. Honestly, I think the most impactful part of that bio was our shared experience during our time at Vanderbilt and being baby interns. We were just sharing that story of when we were working a night shift together and really got to know each other well and take care of patients. And you are exceptional, and you are exceptional as well. I'm so excited to be here. Thank you for inviting me into this safe space. There's a lot of FOMO, that feeling of being missed out, especially for patients with small cell lung cancer, and you guys are filling a huge void. So thank you for having me.
Oh, thank you, Eric. So I would say we have a lot to get through today. I have so many questions. I know Anne does too. So let's get started. Really we're focusing on the importance of community and support for our patients, our smashers, and their loved ones who are impacted by small cell. So, kind of let's look at this from you being an oncologist, right? You're a thoracic medical oncologist, you're world renowned. Education is so important. Community is so important to you. So from your perspective, like as a medical oncologist, what makes small cell uniquely challenging, right? Not just kind of medically, but emotionally, physically, the whole gamut, for our patients and their families.
Yeah, I think this is a really important question and a great one to start off with. So small cell lung cancer is challenging because it moves fast. And we're not just talking about biologically, but also emotionally. And so what I mean by that is medically, it's very aggressive. We know that it's often found at advanced stages. And so our treatment decisions need to happen very quickly. And so we're talking decision making in hours to days, not weeks like we do sometimes for our patients with non-small cell lung cancer. And so that's just the biological and that physical aspect of the speed. Then you have that emotional standpoint, right? Where patients and families are now being asked to absorb all of this life-changing information very quickly, in fact, just as quickly. And what that does, what that speed does, is it leaves them feeling almost vulnerable, right? Like where they have little time to process the fear, little time to process that grief. There's a lot of uncertainty. And that's where I think the support aspect becomes essential, not optional, right?
Yeah, absolutely, absolutely. And I think it's a lot for our patients and families to take on. It's a major life change, right? And I know that me personally, and I know many of the patients that Eric you've cared for and Anne you've cared for, we've seen have to go through this, and so that support and community is really so impactful. And can specifically kind of following that theme, can you think of maybe a patient that you've encountered, a patient experience that you've witnessed that has shaped kind of how you think about roles of support and community in patients who are impacted by small cell?
Yeah. So Misty, like I focus on caring only for patients with lung cancer and have now cared for hundreds of patients and their families just like you. And I tend to remember every story about my patient, right? Not just the diagnosis, not just the patient with small cell lung cancer, but that patient who has this family member, who has this lived experience, who has this milestone. That means a lot to me. And I've cared for patients who have had excellent medical care. We're talking access to top-notch specialized physicians, access to clinical trials, access to all of that cutting-edge data and the treatment. But yet there are some patients who, despite all that access, still feel completely alone, right? And then there are other patients who may be out in the community getting care, may not have as much access to some of these cutting edge advancements, but they have that strong community around them. And they have navigated the very same disease entirely differently, right? And so I'm thinking about one patient and their family, maybe about a year and a half, 2 years ago. And this patient in clinic, we were sitting down, we were there for a follow-up visit. And she told me, she said, Dr. Singhi, I don't feel strong, but I feel held. And I don't
Mm,
know, I didn't really understand at the time what that meant, but it really stuck with me. And I've had more time to reflect on it as I've continued to take care of more patients. And what that meant to me was that the definition of success in cancer care, especially for patients with lung cancer, it's not always about tumor responses on scans. It's not always about the labs that we're checking, right? It's truly whether someone feels supported enough, especially during those really hard days. And I think she was having a really hard day and she was reflecting on it. And she said, I don't feel strong today, but I feel held. And I think
yeah.
that speaks volumes about the importance of support and community.
That is such a story that I think we probably all heard. And, I'd like to just dive a little bit deeper there and think about, what does that support? How does that actually impact the disease? How can making sure, and I used to say to my patients all the time is to, gather your tribe, gather your people,
Mhm.
let people in. There's a tendency, I think, sometimes with any cancer diagnosis that people don't want to share. People don't want to tell, or they keep their circle really small. Don't want to tell people. I always said to my patients, gather your tribe. The more support you have, the better. So how can you just speak to that a little bit about how you think that truly having that community and support actually impacts the diagnosis?
Yeah, I love that you're saying gather that tribe. I think
Mhm.
that should be universal. Honestly, it shouldn't be just for one patient. That should truly be a statement for every patient with cancer, right? That you need to gather that tribe, gather that support. And what I tell people is support won't change your diagnosis, but it will absolutely change your experience of living with it. And I think that's really important, right? And support can affect everything from being able to show up to your appointments, being able to manage your side effects, being able to understand your treatment options, being able to cope emotionally, right? That's a lot. Cancer is more than just the diagnosis, it comes with all of that. And so patients have to feel that support, especially to be able to feel more empowered and less overwhelmed, to be honest.
Yeah, I can't emphasize that enough. And like you said, it is really building that tribe and having personally it gone through this with as my my family, and that was something we kept very private. That was my dad's wishes. It's hard. It's really hard, and I know having lived this for over 25 years, that was part of our goal of creating the Smashers, is that so no one would face this alone. No one faces this alone. No one deserves lung cancer, and no one is alone. We're here for you. Um, so Eric, can I ask, as an oncologist, like if you have a patient there in clinic in front of you, how do you bring this up? How do you talk about it? How do you kind of say, like, where are we? Do they have enough support? How do you have that conversation?
Yeah, this is a good question. So, and like you said, I think just normalizing, gathering that tribe, normalizing into your script, like who is your support system, that's really important, right? And I think that's should honestly be part of our training. So I work with a lot of the trainees
Hmm.
in my institution, and before they even get into the diagnosis and the pathology and everything, I'm like, who is in the room? That's what Dr. Singh
Hmm.
wants to know. Who's in the room? Who do they bring today? That's the first thing I want to know. And I also want to know what do they used to do or what are they doing currently, right? We need to know more about the patient than just their diagnosis. And so
Hmm.
whenever the trainees are presenting me, they're like taking furious notes before they come in, and they're like, "Okay, Dr. Singhi likes to know what they enjoy doing. Dr. Singhi likes to know who are they as a person." So I kind of throw them off their game a little bit, right? But that's the way to, I think, encourage that.
Hmm.
When I'm thinking about how I assess if a patient in front of me in clinic has adequate support, there's really two ways that I do it. First is being straight up, and by being straight
Hmm.
up, I ask questions, right? So, who's with you today? Who helps you at home? Many of my patients know that I love to see photos of them with their loved
Hmm.
ones, of themselves outside of clinic. That's a big one for me. Love watching videos as well too. Social media is obviously really big to me as well too, right? And patients love to show me that, especially around the holidays. So I think ask those questions, see that proof. That's kind of one of the ways I do it. Then another way is a little bit more sneaky, and that's me being less direct, but watching what's happening in the room, right? So who's the person that's taking the notes? Who's the person that's asking the most questions? Who's advocating when the patient isn't being as verbal? That all matters because support can really show up in many different ways. And one of the things I've learned over the years is that silence can be just as telling as what I'm hearing, right? And so if
Hmm.
there's silence in the room, that may hint that there really isn't enough support, and that's something I need to lean into.
Hmm.
And how do you lean into that, Dr. Singhi? If you assess that one of your patients is not supported in a way that you think is going to make their journey easier, how do you approach that?
Yeah. So one of the things I do is I bring it up, right? I say, hey, listen, I'm noticing today that
Hmm.
you don't have someone that's here with you. Is there someone that would like to be here? And then we come up with an idea or a list of ideas. Sometimes the
Hmm.
patient says, I don't have someone, right? And then we really need to brainstorm together. We introduce the community of longevity. We introduce the community of small cell smashers. I also lean on experts in my institution, social work,
Hmm.
right? There are ways to overcome that obstacle, and we can do it together. If I don't have resources at my institution, you guys are incredible to be able to provide that. And so I think if we don't have an immediate solution, we can find one. We can absolutely find one because someone should not be going through cancer alone.
Yeah, and I think, I just want to kind of dive into this a little bit more. Do you see differences? And I know you made that beautiful example of a patient being held. Do you see differences in patients, either in outcomes and tangibles and not tangibles, mentally, physically, psychologically? Do you see differences in patients who are supported by their community, their family, their friends? Are you able to kind of tangibly, put a finger on that and say this may impact if they come to a visit or that they get their treatment on time or, you know, have you noticed anything like that, Eric?
Oh, absolutely, Misty. Yes, yes, yes. So supported patients, they're going to be the ones that tend to ask more questions. They're going to be the ones that communicate side effects earlier, which is really important, right? I hate when patients say, "Oh, I don't want to bother you. I didn't want to trouble you. Send me that message. Get
Yeah.
in touch with us. We'd like to know earlier before the side effect gets worse." And the patients that are more supported also feel more confident in participating in their decision making. It's those isolated patients that will often minimize their symptoms. They feel a lot more like a burden. They're struggling quietly, and that's a huge red flag for me as a clinician. And so there's huge, huge, huge differences on their journey, their experience, their outcomes.
And how do you see that influencing things that, especially in those difficult times, like those
Mm.
difficult conversations, or when someone is having, sort of bad side effects, or, what difference does that community or their caregiver, their family, how does that influence those tough times?
Yeah, I think the tough times that we sometimes predict, and what I tell my patients is whenever they're coming in for scans, for scan day, I
Mm-hmm.
want them to bring someone, and if they don't bring someone, they got to have someone on the phone. It's really
Mm-hmm.
important because there's this concept of scanxiety. I'm sure you guys have unpacked it in previous conversations. It's very commonly known in the cancer community. And patients have that, but so do providers. We have this microdose of scanxiety where sometimes I myself don't even know the scan results until minutes before I go into the room. I always look at the scans myself, and I have a sense of how things are going, but we also wait on our experts, our radiologists, to give us that final read.
Mhm.
And so I think for those tough moments, especially scan days, when patients are often living month by month, if you will, waiting for those scans and those results, you need to have somebody there. Um, Support gives patients space to process. And I think that's really
Mhm.
important. Um, when patients don't feel alone, they're better able, again, to engage in those honest conversations about risks, benefits, goals. And then you can turn that fear and that uncertainty into clarity. And it's clarity and it's with clarity that they can make shared decisions, right? We always talk about shared decision making. So I think that's really the importance of having community.
Yeah, I absolutely love that. And I think, I always think back, probably Anne, you probably remember like the Charlie Brown, the teacher, and like the wah wah wah. It's like you're there, but you're not there.
Right.
And sometimes it is overwhelming, and a lot of these changes you need that backup, that support, those extra set of ears and eyes, then to process and say, hey, well, what about this? Or how would this impact that? Or we had these other things planned or scheduled, or what does that mean going forward? And I think it's so important anytime there's any potential forks in the road, you know, just like
Mhm.
scans, it's so important because at least for me, it's like you tend to kind of don't process it as much as you want or as quickly as you want. And then you get home or you're in the car and then you go, well, dang, I should have asked about
Mhm.
that.
I think
Um,
one of the days that it's really important too is if you know you're going to talk about a new treatment.
mhm,
That
yeah.
gets into that complexity that you're talking about, Dr. Shields, where it's really difficult to process that kind of information
Yeah,
on your own.
yeah.
You've been on one path, you've kind of gotten used to that treatment, you
Hmm.
know what side effects to expect, and I think that kind of goes back to what you were saying, Dr. Singing, about the emotional sort of roller coaster is you just think you're on one path and then you've got to switch, and having to make that switch without good support, I think is it just makes that whole day so much worse not to have somebody there.
Yeah, there's actually statistics on this too. So just even outside of cancer care, people, when they go to a medical visit, will forget almost 40 to
Mhm.
80% of the
Yeah,
information that's verbally said. 40 to
yeah,
80% is gone, right?
yeah.
Um,
Yep.
so obviously two sets of ears are going to be better than one, especially on those hardest of days. And so that's why I think support, having someone there, having someone to process that information, be that memory keeper, be that translator, but also be that emotional anchor, right, in the room. I think
Right.
that's really important too.
Yeah, and I love,
Right.
if I may, I know Dr. Singhi's work through and through, and one of his many beautiful initiatives is being able to tangibly break down so much of the science that's going on into handouts, into information that's readily, easily digestible and available, and it's something that you can walk away from the visit and say, this is what we discussed, and these are the key side effects, logistics, etc. And he's done beautiful work of really trying to take all of these treatments for lung cancer and translate them into patient care, patient facing language. So beautiful. And thank you, Eric, for doing that.
It's very kind of you. Thank you.
Yeah. Okay.
It's important
So
work.
I have so many more questions.
Yeah.
Okay. So we're talking about kind of family and support, these care partners, loved ones. What specifically? I know so many of our smashers and their loved ones, their hearts are just, every single one of them's hearts are just so amazing, and they want to do what's right and respectful and helpful. Like what role can a care partner play with our smashers going through this? How can they help to kind of understand and process this complexity that's going on?
Yeah. Care partners have one of the toughest jobs, honestly. First, what I would say is you have to acknowledge them that they are absolutely part of the care team, right? So that's not an assumption that is like standard, right? It needs to be
Mm-hmm.
they are absolutely part of the care team. So you want to invite them into the conversations. You want to ask how they're doing too, right? Because it's a really tough job. The way I think about it is care partners are running this marathon with
Mm-hmm.
really no finish line in sight. They're grieving while they're caregiving, and that's a dual role that is incredibly heavy, incredibly heavy. And so they often feel this pressure to be the strong one, to be informed, to be positive all the time. And I think what goes unnoticed sometimes is they're also exhausted. They have fear. Sometimes they have guilt. It's a lot to be a care partner. And so I really just want to call that out and show my appreciation for them and let them know that they're part of the team. And I think that's what we all need to do. But I also think we need to connect them as well with resources. So counseling, advocacy, social work. I think that's all just as important. And I know LUNGevity has some amazing efforts to help care partners. Maybe you guys can speak a little bit on that and what you can offer.
Yeah.
Yeah, I absolutely. I 100% agree with you. And having just come off of my own caregiving, it
Yeah.
kind of it that really hit me.
Yeah.
Because it's true. It's a hard job. And I do think that sometimes their efforts do go unnoticed. And we do encourage, caregivers, I think, and I even speak from my own experience that, I'm not the one going through this. You
Yeah.
know, my life is good compared to my loved one. So there is that guilt. So I think it's hard to ask for help. It's hard to say you need help, because you feel like your loved one is the one who needs everything. So I would
Yeah.
truly encourage caregivers in our Smashers community who are listening to this today, please reach out for your own assistance, because unless you're taking care of yourself, you really can't be a fully effective caregiver. And, we have resources where we have some online support groups that are just for caregivers.
Love that.
So, develop your own community. And another thing that I used to always say this to caregivers when I was taking care of patients: if one of your neighbors, one of your good friends ask you what they can do, give them a task. Even if it's just, would you come and vacuum my house today? Or our bedroom is really dusty and I just haven't had time to get to it. Any of those little things that kind of make you feel better about your environment, or come sit and I just want to do the grocery shopping. I haven't left home in a week. Could you come sit with the loved one so I can go to the grocery store? Please, when people ask you what they can do, people, as a caregiver, they love you, they see you, and they know that you need things. So don't hesitate as a caregiver to ask for help. It's really important.
Absolutely. And I feel like, sometimes support externally from a family, outside comes in waves. And it feels like sometimes, especially, if you're grieving, there may be a lot of people right at the beginning, and then it's those moments afterwards where it's quiet. So if you know someone outside of even a small cell, just anybody impacted, always reach out, because you never know. It's
Mhm.
people feel like they're forgotten about, and they're still they're still there. And I think it is important that we never forget, and we always are just supporting each other. I think it's a
Mhm.
good habit to have. Okay. So Dr. Singhi, how do you balance all of the medical knowledge you have, right? All the trials, all the things, the data, with seeing a patient and then having a loved one that maybe there's somebody's not on the same page. How do you honor values, respect their preferences, kind of work through those certain family dynamics? How do you navigate that?
I mean, obviously, being at a place like MD Anderson, you also have a lot of cultural differences.
Yeah.
Yeah.
So there's a lot, just tagging on to what Dr. Shields said, there's a lot to balance there.
Yeah.
Yeah. No, I think this is a great question. I was actually reflecting on this question earlier this week for World Cancer Day. I made a little video about it, just thinking about how grateful I am that we've had so many advancements in treatments, better science, right? Better treatments, better clinical trials, all of that. We still have a long way to go. We have a lot more to do, a lot more work to do, Dr. Shields, myself, and the entire community. But with more of these treatments comes more options, right? And more, I think, decision making, honestly, which can be really complex. And so I think the role of the medical oncologist, my role in clinic, has shifted a bit. It's not just to recommend treatment, it's truly to understand what matters most to the patient and their family. And that can mean longevity, it can mean quality of life, it can mean independence or family milestones, right? You need to figure out what those priorities are so you can guide the decisions in clinic for your patient, for their family. And I really think that the best cancer care happens when you bring the medical evidence, which Dr. Shields knows I'm obsessed with and I'm always following up on with all the conferences. You bring that with personal values. I think that's where the best care happens when you bring those two things together.
Yeah. And I think it's, it's personal values of the patient and their loved one, right? And so many times I know some of our smashers have been in this scenario where maybe a parent doesn't want to pursue a treatment and they do,
Mhm.
right? And that's really hard. And I think acknowledging that and that does put our loved ones and care partners in a position maybe that is not what they would want. And I think it's, again, being in those conversations, being in the room and having that safe place to have that conversation so that both the patient and the loved ones can really make sure their voices are heard. I think that's
Mhm.
important.
Mhm. I think those conversations, those difficult ones, like if you're reaching that point of, you know, the loved one is ready to stop, for instance, and says, I don't want to be treated anymore. And the caregiver is not ready.
Yeah.
Being able to have that honest conversation with your healthcare team is really, really important
Yeah.
because when you are having that conversation at home, truly your personal feelings are taking precedence, right? And you're not being able to weigh your personal preferences with that medical knowledge. So having a care team that can sort of give you all of the pros and cons and help you make a decision as a supportive couple or as a supportive team, I think that is a gift. It is a gift if you are are a medical oncologist who will have that conversation.
I think so. And kind of just to follow up on that, like, how, what guidance do you give in that situation where maybe a loved one's worried about saying the wrong thing? That they may talk to you privately outside the clinic room or outside the hospital room. How do you navigate those conversations and support both the patient and a loved one?
Yeah, I mean, I think that's a great question, Misty, and I think we've all had these um, cases and experiences in our clinic. I want to understand the goals, right, of the patient, but also the goals of their family too, right? And sometimes they're aligned, sometimes they're not. And you have to have that transparent conversation. I think it's so important. Everyone needs to be on the same page, and we need to remember that truly, I think what's guiding the experience is the patient, honestly. Forefront of my mind is my patient. And sometimes just that communication isn't there, like you said, Anne, and you need to have that conversation in clinic together with the evidence, with those personal goals, with everyone in the same room. So I think opening up a safe space just to have those conversations is
Mhm.
incredibly important. And I feel like that's the
Mhm.
best way I've navigated situations like that. Um, the other thing too that I was just thinking about is being afraid of saying the wrong thing, right? So
Mhm.
even outside those difficult situations, people sometimes are afraid of saying the wrong thing, so they don't say anything at all, right? And
Mhm.
then that's where you lose the potential for support and the potential for community. What I tell people is just showing up matters way more than saying the right thing, right? Presence matters more than your language. And you can even just say, I'm here, or just say, I don't know what to say, but I care. I care about you. And that can be enough sometimes,
Right.
right?
Yeah. Yeah, I love that. I love that. Um, how can family members or care partners kind of ask for more support? Like, do they say I want to talk to the social worker? Like, is it I want to talk to child life? How does a loved one or a patient like go about asking for this?
Yeah, I wish we made it more just standardized, right? I think that's what we're trying to do. I think just as important as all the advancements in our treatments and our treatment armamentarium for patients to help fight small cell lung cancer should be advancements in research dedicated to multidisciplinary care. So supportive care, social work, really optimizing that patient experience and journey as they go through this diagnosis of small cell lung cancer. And so that's what I'm trying to do. These are some of the research efforts that I focus on as well too, is access to multidisciplinary care early. We've seen benefits, right? We've seen that patients
Mhm.
who are referred early to supportive care services, to palliative care
Mhm.
services, they not only have a better quality of life, potentially also can live longer, which is huge. It's
Mhm.
impactful. And so that speaks volumes about the importance of access to support services. And so I
Yeah.
constantly have this on my checklist. I'm constantly thinking about my patients. If I need to refer them early. If you've thought about it once, do it, right?
Mhm.
So my rule is if you've thought about it once, go ahead and do it, right? Like if it's in the background of your mind, go ahead and do it. And just make sure patients and their families are aware that we have these services. And so,
Yeah,
so I think, yeah, just standardizing it and being quick to grab those resources, even before sometimes the patient verbalizes it.
it's great. Well, I think we're going to change direction just a little bit. And I think this is a really important topic within our community. And in fact, it has come up within our community within the last week.
Mm,
What is stigma?
mm.
What impact does stigma have on a patient, a survivor, a caregiver, and the community at large? And is the stigma warranted? And how is it helpful or not helpful?
Yeah, I rarely get angry. I get angry when I see stigma in real life, when I see it affecting my patients, when I see it affecting their family. That's what makes me really upset in cancer care, to be honest.
Mhm.
No one deserves cancer. Full stop. We're done. We could end this whole conversation right now with that statement. I strongly believe that. To me, stigma is misplaced blame, and it absolutely has no role in cancer
Mhm.
care. What it does is it isolates patients, it delays treatment, it delays diagnoses, it delays healing, and it is never helpful. And I'm very strong and passionate about that. So really, no role. All it's doing is it's delaying care, and it's really making those outcomes that we can sometimes achieve for people even harder to achieve. And so, yeah, definitely no role.
How do you, and I'm just, this came up recently in a newly diagnosed patient who
Mhm.
has not been part of the larger community, who, you know, brought their own feelings of stigma to the community.
Mhm.
How can the community gently support that person who is just newly diagnosed, is going through their own stages of grief? Because I agree with you, stigma has no place. But as a newly diagnosed patient, you're bringing your anger, you're bringing your own personal grief, and community can sort of either make or break that. So
Mhm.
how would you advise, even our community of healthcare providers and our smashers community to embrace that newly diagnosed person who may have stigma attached to them? Because what you said previously is absolutely true, and we need to get that message out in a gentle and supportive way.
Yeah, I think first acknowledging that there is grief, that there is anger with a life-changing diagnosis is the first thing that needs to happen, right? So I think I would welcome this person in and I would say, your feelings of being angry, of having grief are absolutely valid. And I think really reframing the stigma into
Mhm.
identifying what they're truly feeling and how you can act on it in a positive way is the way to do it, right? So I still think stigma has no role in cancer care, but what we can do is we can reframe, we can relabel, we can identify what they're feeling, and we can have a tangible action or endpoint of how we can make that a positive thing, right? I think that's the way to do it, to be honest. I would continue to just really lean in on acknowledging and validating someone's experience before attacking them for what they're bringing in. And I think that's the way to really approach that.
I love that.
Yeah,
That's perfect.
absolutely love it. And Dr. Singh, as stigma can have some real tangible negative outcomes. It may mean that a patient doesn't seek care or get lung cancer screening,
Yeah.
right? Or get, treatments, or they may delay or they may reschedule that follow-up visit that they were going to have and say, well, they place that weight of stigma on them, and that may affect their value personally, and it does. And these are real outcomes that our patients face, and like you said, stigma has no business being in in cancer care, and especially in lung cancer, and especially in small cell. It's not welcome here, so
Nope, out the door.
out the door.
Yeah.
What kind of on that same vein, what other barriers do you see, maybe in your clinic or from patients that you've interacted with all over the world, that it might prevent patients from accessing support, supportive services, anything else, kind of social, emotionally, systemically, that you might have noticed?
Yeah, there's unfortunately so many barriers to getting that optimal cancer care, beyond stigma. So time, right? That's a huge one.
Hmm.
Transportation. Unfortunately, financial stress is also a big one.
Mm.
So we talk a lot about toxicity from our treatments, but there's also this concept of time toxicity, financial toxicity. They're huge. There's also lack of awareness, being emotionally overwhelmed. Sometimes patients and their families don't even know what exists, right? And so I think that awareness aspect is huge. That's why these webinars and these chats and these communities matter so much. And the one that breaks my heart is sometimes people don't feel worthy of support. And I
Mm.
think that's one that we have to intervene on. That's why we have to reframe these conversations about lung cancer. That's why there is no room for stigma. Needing help is not a weakness in cancer care. It just means you're human, right? And so
Hmm.
I think we have to get that message out there and just normalize emotional well-being, normalize asking for help. All of that is so important in cancer care.
And you mentioned even earlier, and I love the fact that you said it needs to be a standard,
Hmm.
so that when you as an oncologist, Dr. Shields or Dr. Singhi, walk into a room with the patient, that you don't even expect that patient and their care partner to tell you they need help. You assume that they need help because, having done this for as long as we all have done it, and I've done it twice as long as you all have, that we know it's true. Whether they reach out and tell us they need help or not, we know the roller coaster of emotions that they're on. We know that, dealing with insurance, just even trying to get scans scheduled sometime can just be so stressful,
Yeah,
that you need a scan next week and radiology's telling you it's in 2 weeks. And
yeah,
when a patient gets angry about that kind of thing, again, there should be no stigma in that. Of course they feel angry. They're incredibly anxious, and having to wait longer than necessary to get tests done is overwhelming.
yeah.
So I love the fact that you say that recognizing those barriers, recognizing those challenges should be a standard of care.
Yeah, absolutely.
So,
Uh, yeah, go
oh, go
ahead.
ahead. Go ahead,
No,
Dr.
no, no.
Shields.
No, you were transitioning. I'll let you
Yeah, no,
follow
I
that
was just
follow that train of thought.
all that
I'm here.
train of thought.
I'm
We
here for it.
So, I know that, you are truly one of our greatest supporters, Dr. Singhi. It's such a privilege and a pleasure to always work with you. And you're just so generous with your time. But I know that, longevity and smashers aren't the only groups that you work with. And I'm sure that you also have local resources. So, talk to us a little bit about when you do recognize that a patient or their caregiver, their support team needs help, what resources do you offer to patients, and how do you help them connect with those resources?
Yeah, that's a great question. I'm a big believer in trying to connect patients early to support networks.
Mhm.
And so we'll do that at my institution, right? I've integrated into my first visit with all of my patients. We talk a lot about what we call advanced care planning. So getting to understand what their goals are from a medical standpoint, getting to understand and make sure that they really truly understand their diagnosis, things like prognosis, if they want to understand and lean into more of that, being able to make those medical decisions with informed decision making, right? And so we have all those conversations as a standard right up front. And then part of my standard is introducing them to all the resources at my institution, social work, case management, often supportive care, palliative care. But there's also other resources in the community as well. Early connection really helps patients and their families feel less alone from day one. And so I'm a big believer in just trying to integrate it into the script, right? It's the initial visit, it's the consult visit. make it part of your script.
Yeah, I
I
love
absolutely
that.
love that. Love that. Love that. And just kind of following up on that, how can, you know, I know your practice, I know your preferences, but how can other clinicians, medical oncologists, radiation oncologists, surgeons, palliative care, integrative medicine, how can other doctors, advanced care providers, nurses, team members help connect patients to these trusted networks? Like what resources are out there?
A lot of people are using online resources and social media. You guys know I do a lot of stuff on social media. I think getting the word out there, making it a lot easier to make these connections is really helpful. So not everyone learns the same way. Yes, I have some patients who want that printed information, who want that printed flyer, but I also have patients that are like, I don't want to have that. It's going to get lost in my car. It'll be on the floor. By the time I get home, it's torn and I can't even read any more of the information. They want the QR code. They want the access to the link. And so I think it's actually on us to make sure that there are various ways for patients and families to connect to these support groups. And like I said, I work with a lot of our trainees. I help direct our thoracic medical oncology rotation. And so it's also on us to teach the next generation of oncologists and care providers to say, hey, listen, this needs to be part of the script. This needs to be part of the standardized experience. Don't just focus on PFS, OS, the objective response rate, the scans, RECIST version 1.1 criteria. You need to focus on connections, community, support, make it standardized, make it a script. I feel like I keep saying the same thing, but I want to make sure that that's what we do.
Yeah, it's so important, and it's really seeing the patient as a whole and not just a scan, a lab, a visit, a diagnosis, right? It's seeing them as a whole and realizing there's all these pieces that we have to, be mindful of to really help support the patient and their loved ones.
Absolutely.
But I also hope that our smashers are hearing what Dr. Singhi and Dr. Shields are saying, and that if your care team doesn't bring it up to them. Um, not every single medical oncologist has it in their standard uh, meet and greet with their patients, but I think we have heard today how important this is. So, by all means, when you are in the room with your care team or you're with your nurse navigator, ask for resources.
Yeah.
Let them know that you need those resources and that and like Dr. Singhi said, do you want written material? Would you like to have links to websites, information like we said at the beginning of this fireside chat, that we have live events, we have virtual events. There's so many ways for you to get connected with community. So if your doctor doesn't bring it up, make sure you bring it up to your doctor.
Of
Absolutely.
course, of course. Well, I want to be mindful of time, Dr. Singhi, and kind of have a little bit of space here to look ahead. And something that we always really hold near and dear is the hope. Hope for now, hope for in the future, hope that less people are diagnosed with small cell, less people are impacted by small cell, that we're surviving and thriving, which so many of our smashers are doing and really breaking through that glass ceiling. So, as an oncologist, what kind of gives you hope for small cell?
Yeah. Oh, I love this question. This makes me really happy and it's making me smile. I've been saying this now for a few years, actually, that there have been big changes in small cell lung cancer, right? I mean, that should be the new slogan is big changes in small
Yeah.
cell lung cancer. Progress, progress, progress. And we're seeing these advances in research and clinical trials, more data from drugs like tarlatamab, antibody drug conjugates, or those ADCs. But there's also growing recognition and research, I think, showing the importance of supportive care, of multidisciplinary care. I love that aspect of that research that's also happening, not just the drugs, but the delivery of care and how that can make a difference, right? Um, I think hope comes from the science, it comes from the data, it comes from the clinical trials, but it also comes from the community. And that's why I think what you guys are doing in this safe space that you have created is incredible. It's inspiring, and it's what's fueling the hope in addition to the science.
It's amazing.
Thank you, Eric. That's really sweet. Um, and I think that really kind of highlights that this is not just the trials and the data that we see at ASCO, our big annual conference that's coming up here in May and June in Chicago, which we all are always looking forward to, because those new trials mean usually new approvals and new therapies, you know, and I think that, like we've highlighted here, you know, treating the patient, supporting the community, and really amplifying that support is part of cancer care and should be part of cancer care, and helping patients have better outcomes and better quality of life.
I think there's one more
Um,
thing, Misty, if I can touch on. I
yeah,
don't think we've touched
yeah,
on it yet, or maybe we've hinted on it, but haven't directly leaned into it, and that's that mental
yeah,
health aspect and
yeah.
the emotional
Mm.
health. Um, I think as oncology providers and care teams, we do a really poor job of routinely asking about emotional health and mental health. I wish it was a lot more routine. Like we ask about nausea and we ask about pain. Um, I really wish it was more integrated. I actually have this amazing colleague here at my institution who's a psychiatrist, and she specializes on mental health for patients with cancer, not just lung cancer, but any type of cancer. And we were doing a podcast together, I think last year sometime. And I loved what she said. I like will not forget it. She basically said, we all get these routine dental health checks. Well, what about routine mental health checks, right? She like normalized it. She made it routine. She said, okay, it's just another part of taking care of your overall health. And I think that's so important. And like Anne said, if your provider team is not asking about your mental health, if they're not asking about your emotional well-being, you need to bring it up. And you should feel empowered to be able to do it because
Yes.
this mind, body, soul connection, I'm a big believer in it, is huge. Our hope is to give people not weeks, not months, but years with living through this cancer experience. And you can't do it without also making sure that your emotional well-being, your mental health are supported. And so I just wanted to put that plug in as well.
Yeah.
Yes. Very important. Very, very important. You know, if you could just give our Smashers community one piece of advice about what everything that we've talked about today, what would you tell the community?
We talked a lot about great things today.
Yeah.
I would say you don't have to do this alone, and you shouldn't. It's really important to ask for help early and accept that support. And just know that community is not this privilege. It's not this luxury in cancer care. It is part of the treatment. There's medicine that treats the disease, but community and support is what treats the person. And you need both. And you can't have ideal care one without the other. I think that's really what I would stress.
I think that's a perfect point. I
Yeah.
don't know if we have questions. Um, our background longevity staff, if there are questions that you need to bring forward, um, please, Smashers community, this is your opportunity to ask
Mhm.
Dr. Singhi anything that you want to know about support, community, resources. So please feel free to ask questions.
I have one question. Eric,
Yeah,
can you tell us a little bit about what you're doing with young onset lung cancer?
Oh,
Tell us about
that's a
what is
great
young
question.
onset lung cancer,
yeah,
and
yeah.
what are you
Thanks
guys
for
what are you
sharing
guys
this.
doing?
Yeah, so really appreciate you asking about this. So this has really become a passion of mine in terms of the care population that I care for and then the research efforts. So what is young onset lung cancer? So traditionally, the average age of a person who's being diagnosed with lung cancer is 70, right? And that tends to be that older population, not necessarily always true, but that average. About 10% of patients nationwide are being diagnosed under the age of 50, which is what we define as young onset lung cancer. And that number is unfortunately growing. We're learning several different risk factors beyond smoking, that traditional risk factor, that are causing these rates to grow in young patients. What we found over the years is because this has been an underrepresented population, is we don't really understand their cancer care experience. We don't support them well when they're often making some of these dramatic life-changing transitions, supporting a family, trying to think about developing a family. We do a really poor job as a community because we haven't had as much of an experience of taking care of them. And so at my institution, I serve as our medical oncology lead for our young onset lung cancer program. where we are truly trying to provide comprehensive care for patients under the age of 50 with lung cancer. And we're doing it in a way that is objective with research built in. I lead our registry trial as well too, capturing all of the data, not just how patients are doing on their treatments, but patient-reported outcomes as well. And so I hope to continue to share all of those research findings and better the experience for these patients.
That's amazing. Amazing work.
Looks like we have some questions here in the chat. I see one question. This is a great one. Can
Oh,
you tell us about oligoprogression? What is it? How do we usually treat it in the context of in small cell? What does oligoprogression mean?
yeah, that's a great question. Well, okay, so I'll lean on you, Misty, too, to get your thoughts. So oligoprogression, what it means is a patient may be on treatment, they may be getting their drug therapy, and things are going really well. And then unfortunately, on their next scan, we see that there is maybe one, maybe two spots that are starting to grow. I call it breakthrough disease, where the majority of the disease is being really well controlled on the drug therapy that you're on. But unfortunately, a few of the cancer cells have learned to outsmart that drug, and they're starting to cause some problems on scans, hopefully not symptomatically, but that's also a potential. So what do we do? Well, if we're on a therapy like immunotherapy, even tarlatamab now, right? There may be opportunities to keep you on that therapy if it's controlling the majority of your disease, but pull in what we call local therapies to address those breakthrough sites that are causing problems on scans or with your symptoms. And we can do that with things like radiation, less commonly, but still potential surgery, and maybe even ablation, right? Where we're using energy, heat, cold, to address and attack that specific lesion that's causing trouble. How do you think about oligoprogression, Dr. Shields?
Yeah. So I think this is a fantastic question because we've actually looked at our own patient data at Indiana University, and patients who have oligoprogression compared to what we call multifocal or non-oligoprogression, meaning more than five spots and more than two areas of the body. Patients who have oligoprogression um, do fantastic. They have great outcomes, and most typically they stay on the treatment that they're on. And as mentioned, getting targeted local therapies to really maximize the current therapy. But we've looked at it in patients. We've actually looked at patients, we hear these things like platinum resistant, platinum sensitive, or those platinum free intervals. We even looked at patients who had oligoprogression but had platinum resistant or early relapse. And those patients do better than patients who even had platinum sensitive disease with multifocal. So it actually may be a better surrogate for outcomes than even platinum, response that we've always thought of
Mm.
historically for small cell. We've actually looked at this, have a paper that we've submitted on it. So great question.
Yeah, I love this
And
question. Yeah.
yeah. Um, Well, I want to be mindful of time. If there's any other questions, I think, Dr. Singhi, I could talk to you obviously for hours and usually do.
Yeah. I think everyone here
But
knows that we are very dear friends and we spend a lot of time
yes,
together
yeah,
all over the world. Honestly, right? We've traveled to
yeah,
Singapore together. We've been in Nashville
exactly,
together.
exactly.
I could go,
Hawaii, yeah,
yeah, Hawaii. Yeah.
yeah. So, but I want to thank you from the bottom of my heart, and I think Anne feels the same of everything you're doing for our patients, our smashers, their loved ones, the community, patients with lung cancer, your patients, and all over the world, all the education and outreach, and changing really the knowledge, the face, the community, the culture of lung
Mhm.
cancer. So thank you for everything you're doing. It's meaningful. It's helping raise the conversation, having those shared informed decision makings so that patients have that information. They know what to say, when to say, how to bring this up, how to navigate it. Thank you for everything you're doing. It's so meaningful, and it's changing patients that you've never met lives all over the world. Yeah, so thank you.
That's incredibly kind and right back at you guys. And I really think the only way we're going to move forward is together. And you are creating this safe space, this important safe space to be able to do it. So thank you guys.
We
Thank
we
you.
definitely I echo Dr. Shields. We thank you so much. And I think that it's so important that you, both Dr. Shields and Dr. Singhi, realize that this is raising the bar on cancer care. It really is raising the bar that um, as you all know, I've been doing this for a long time, and these were not the standard questions, 20 years ago. 30 years ago, 40 years ago when I became a nurse. These were not the standard questions. And, you know, the things that we expected from our patients were completely different. So just as a long time healthcare provider in the lung cancer space, I just say thank you to you all so much for raising the bar on cancer care and giving us this opportunity to share this through LUNGevity, through Facebook, and through our Smashers community. Again, I hope that all of you will consider joining us for our Smashers Live event the first weekend in May. Dr. Singhi will be there. Dr. Shields will be there. I will be there. And also to join us again on March 20th when we invite Dr. Laura Alder to join us for our next Fireside Chat. So thank you, and thank you to all of the Smashers who joined us today.
Thanks, everyone. Take care.
Thank you. Thanks, Eric.